Okay, my name is Heun. I'm a consultant psychiatrist, and I'd like to talk about dependence in our series Mental Health Explained. Dependence is characterized by a couple of features, usually described first in alcohol, but they also apply for others. Usually, the first thing, or one of the most important thing, is what they call the primacy of drug-seeking behavior. So it is the importance of the drug which takes precedence over other aspects of life. People don't bother about their work, their relatives, their finances, and their other parts of their health. They just want the drugs, and so it then might even lead to criminal activity to get this drug or to being able to afford this drug. So let's say it that way, the drug becomes the most important part in a patient's life. What happens very often in dependence is that the drug-taking repertoire gets narrower. That means people don't drink all types of alcohol, they're specific type of alcohol, or they don't take different types of psychedelic drugs anymore. They just take one and focus on heroin, which they then inject, but they wouldn't take them in different ways. So this is a little bit of narrowing of the activities. Then what happens in all drugs, that the effects are more coped with, people are more tolerant, they might use more drugs to combat the intolerance. They might take drugs in a different way, which makes them more easy to reach into the system or to reach the brain. So let's say that heroin won't be smoked anymore. It might be injected. Some others have different chemicals. Crack cocaine is very fast getting into the system, and in this respect, many people take it. There is also in dependence a loss of control of the consumption, so people can't stop taking the drugs, and they can't stop thinking about the drugs. Usually, after a while, you have withdrawal symptoms when you stop trying to take the medication. These withdrawal symptoms are quite different from drug to drug. In alcohol, it might be shaking, it might be an urge, a craving for the drug. And then sometimes people start taking the drugs not for the effects of the drug, but they start to avoid the side effects, so that for years on end people might take heroin because they fear the heroin withdrawal symptoms. That's very, very common in some drugs. Same thing for alcohol. And the other thing is they accept taking the drugs even though it has negative consequences. It might lead to social withdrawal, a loss of the job, but people can't take it. It might be marital breakup or prison terms, but even then it's not possible. And what's another feature of dependence is that if people have had times of abstinence, they usually, when they get hands on the drug again, they have a rapid reinstatement of the previous pattern. So they just take the drugs as they have been taking it before. It's not getting used to a drug again. They just take the drug as they have been taking it just before they stop taking the drugs. So that's the rapid reinstatement of the previous pattern. So I mentioned these dependence syndrome features: primacy of drug-seeking behavior, narrowing of drug-taking repertoire, increased tolerance to the effects of the drug, loss of control, signs of withdrawal when trying to be abstinent, drug-taking to avoid withdrawal symptoms, accepting drug use despite the negative consequences, and reinstatement of previous patterns after stopping the drugs. Thanks for your interest, and if you like us, please subscribe to our channel, Global Psychiatry Archives. Thanks a lot.